UK residents who are fully vaccinated through the UK vaccine rollout will no longer have to self-isolate when they return to England. They'll still be required to take a test 3 days before returning, the pre-departure test, demonstrating they're negative before they travel, and a PCR test on or before day 2, but they will no longer be required to take a day 8 test. In essence, this means that for fully vaccinated travellers, the requirements for green and amber list countries are the same. To be clear, a full vaccination means 14 days have passed since your final dose of the vaccine. And it's also important to note that health matters are devolved. So decision-making and implementation may differ across UK administrations, and we'll continue to work with the devolved administrations to ensure we achieve our shared objectives of safe, sustainable, robust return to international travel. Madam Deputy Speaker, the change I'm announcing today will prioritise those vaccinated in the United Kingdom. However, as I made clear last week, we want to welcome international visitors back to the UK and are working to extend our approach to vaccinated passengers from important markets and holiday destinations later this summer, such as the United States and the EU. And I'll update the House in due course on how we approach vaccinated individuals from other countries. When I highlighted the potential policy to the House last week, I explained that we needed to take some additional time to look at how children and the evidence around children who will not, of course, have been able to benefit from vaccines would be treated. I can tell the House today that children under 18 returning from amber list countries will not have to isolate on their return nor take a day 8 test. Children between the ages of 5 and 10 will only need to take a day 2 test, and as before, children 4 and under will be exempt from all testing and isolation requirements. I know this was a big concern of families, and after working with the scientists and public health experts, I'm delighted to be able to offer that reassurance today. The success of our vaccine programme has been aided by those selflessly creating the great benefits for society and the rest of the world by being a part of those clinical trials, without which we wouldn't have this vaccine programme. We're committed to ensuring that they are not disadvantaged as a result of being part of those trials, and I'm delighted to announce that those on approved clinical trials in the UK will also not need to self-isolate or take that day 8 test from an amber list country. Passengers should, of course, check with the Foreign Office travel advice to understand the latest entry requirements and COVID-19 rules at their destination. And Madam Deputy Speaker, we know that travel is important, that many people have not been able to travel, of course, for the last year and a half. This is not just, of course, about holidays, eager as we are, I'm sure, for time in the sun, but this is also about reuniting families who've been apart throughout this pandemic. It's about helping businesses to trade and grow, and it's about supporting aviation, a sector which hundreds of thousands of jobs rely on. An industry which this government has backed through £7 billion of support through this pandemic. And as the industry tell me, the support is, of course, very welcome, but the only way to actually recover is to allow them to fly and for travel to resume again. Which is why I'm pleased to also announce today that from the 19th of July, we'll remove the guidance that people should not travel to countries on the amber list. And this means that people will be able to travel for leisure, for business, and to see family to amber list countries. I'm sure the whole House will welcome this development and approach to international travel. However, I want to be clear that as we begin to ease restrictions, travel will not be the same as it was before in, say, 2019. People should continue to check Foreign Office travel advice, travel where possible outside of busy weekend times, and importantly, they should expect that their experience at the border will of course be different because longer waiting times will be necessitated by risks, even as we introduce and expand the range of e-gates available to read the passenger locator forms. I must also make clear that public health remains our key priority, and that's why we'll not make any changes to requirements applying to those arriving from countries on the red list, even where they are fully vaccinated.